Today, we're diving into the intrauterine device, the IUD. It's one of the most effective forms of birth control out there. But how does this tiny little device actually work? And what's it really like to use one? Let's get into it. So let me just start with a big question. What if I told you there was a birth control method that was over 99% effective? That sounds almost too good to be true, doesn't it? Well, that is the incredible level of reliability we're talking about with the IUD. Okay, now what if that same method could keep working day in and day out for up to a decade without you having to do a single thing? Yeah, that combo of effectiveness and just pure convenience is exactly why the IUD is such a total game changer. So, what exactly is an intrauterine device? Well, think of a small, really flexible T-shaped object. A doctor places it inside the uterus, and its whole job is just to prevent pregnancy. It works quietly and super effectively, right from the inside. Okay, so we know what it is. But how in the world does this simple-looking little thing actually stop a pregnancy? Well, the science behind it is pretty cool because it's not just doing one thing. It's actually got a multi-pronged defense system going on. IUDs are really clever. They work in a few different ways all at once. For one, they mess with how sperm can move, making it pretty much impossible for them to get to an egg. They also change the lining of the uterus, so even if an egg did get fertilized, it's not a welcoming place for it to implant. And this is key. The IUD creates this little inflammatory reaction that's totally harmless to you, but it's a really hostile environment for sperm. And the best part, the whole insertion process with a doctor usually takes just 5 to 10 minutes, and then boom, you've got continuous long-term protection. Now, here's something that might surprise you. This is not a new invention. Not at all. The idea of an IUD has actually been around for over 100 years. And boy, has it gone through some major changes along the way. Yeah, the journey started way back in 1909 with a ring made from, get this, silkworm gut. A little rustic, for sure, but hey, it was a start. Then you fast forward to the 1960s, and we start seeing the first plastic devices. But the 1970s, that was the real turning point. That's when the T-shape we know today was developed, and when we first saw hormone-releasing IUDs. And all of that innovation led to modern devices like the copper T380A, which got approved back in 1988 and is still one of the most common IUDs used today. So all that history brings us to today, where you've basically got two main players in the IUD game, copper and hormonal. They both do the same job, but they go about it in totally different ways. This breakdown really lays it all out. On one side, you have the copper IUD. It's totally hormone-free and uses copper to basically create a no-go zone for sperm. On the other side, you've got hormonal IUDs, which release a tiny bit of progestin to thicken cervical mucus. Think of it like a roadblock for sperm. And as you can see, this one core difference affects everything, from how long they last to how they impact your period, which, let's be honest, is often the biggest factor for people when they're trying to choose. Let's zoom in on the copper IUD for a sec. This is the go-to for anyone looking for a non-hormonal option. The copper itself releases these ions that are toxic to sperm, stopping them in their tracks long before they have any chance of reaching an egg. Simple and effective. And on the flip side, we have the hormonal IUDs. These guys release a really small, localized dose of a hormone called levonorgestrel. Their main move is to make the mucus at the cervix super thick to block sperm, but they also thin the uterine lining, and that can mean much lighter periods, or for some people, no periods at all, which can be a huge benefit. Now, while copper and hormonal are definitely the main event, there is actually a third type out there, though it's much less common. These are non-medicated IUDs made from just plastic or stainless steel. They work on a really basic principle. Just having a foreign object in the uterus is enough to create a reaction that prevents pregnancy. All right, so no medical device is perfect, right? There are always trade-offs. So to really understand the whole picture, we have to take a good, balanced look at the pros and the cons. First up, let's talk about the good stuff, the really significant benefits that make IUDs such a popular choice for people all over the world. The benefits here are seriously compelling. You've got that incredible effectiveness, of course, but then there's the whole set it and forget it thing that just simplifies your life. A huge plus, though, is that it's completely reversible. Whenever you decide you're ready, you get it removed, and your fertility bounces right back. When you add in that it's cost-effective in the long run and doesn't mess with other medications, you can see why it's such a strong contender. But, to get the complete story, we absolutely have to talk about the potential downsides and side effects. Okay, first and foremost, and this is a big one, IUDs offer zero protection against STIs. You still need to use condoms for that. Now, while it's very rare, there are some small risks during the procedure itself, like perforation. And like we touched on, your period can change. Copper IUDs can make them heavier, while hormonal IUDs might cause side effects like headaches or acne for some people. It's all about weighing those possibilities. But wait, the story of the IUD doesn't actually stop at contraception. Let's pull back and look at the bigger picture, because this little device has some other incredibly important medical uses. For starters, a copper IUD is one of the most effective forms of emergency contraception there is. But beyond that, hormonal IUDs are often prescribed for reasons that have nothing to do with birth control. We're talking about treating conditions like super heavy bleeding or really debilitating period pain and other pelvic issues. For a lot of people, they offer truly life-changing relief. This quote right here really gets to the heart of what makes the IUD so powerful. Even though it works for years, the effect isn't permanent. The second it's out, a person's natural fertility comes back, which gives them complete and total control over their own timeline. So, we've gone from a simple ring of silkworm gut over 100 years ago to these incredibly engineered, sometimes hormone-releasing systems today. It's just an amazing story of medical innovation, and it kind of leaves us with one final thing to think about. What's next? What does the next 100 years of innovation in this field even look like?